Hi, I'm Dr. David Hill, and today we're going to be talking about walking pneumonia in children. Now, I've always thought this is a funny name because the pneumonia is not walking, right? The child is walking. This is distinguish it from pneumonias that might leave the child bedridden or hospitalized. It's a very old, archaic term from a time before when we knew what caused pneumonia. We just knew that some were really bad and some weren't so bad. Most pneumonias in children that don't make them seriously ill are caused either by viruses, which tend not to respond to any therapy whatsoever, or by what we call atypical bacteria. These are usually members of the Mycoplasma group, although chlamydia is another type of atypical bacteria. Atypical bacteria we usually treat with a group of medications called macrolides. These include erythromycin, clarithromycin, and azithromycin. Among the most popular of these is probably azithromycin, Zithromax by brand name. That's because it doesn't seem to cause as much intestinal upset, and you can take as few as 3 days of medicine, in some cases just one big dose, and be done with the infection. It lasts much longer in the bloodstream, so you don't have to take it for as long to treat the infection. Diagnosing a pneumonia is based partly on symptoms. Has your child had an unexplained cough for more than 2 or 3 weeks? Does your child have chest pain? Is he or she short of breath or wheezing? Now, wheezing may only be heard by a stethoscope exam and often indicates a viral infection or asthma, but sometimes we see this with pneumonia as well. Fevers that go on more than 3 days accompanying a runny nose, stuffy nose, or cough can suggest either a pneumonia or a bacterial sinus infection. So if your child's fever lasts more than 3 days, or if your child has a fever that comes on for a few days, goes away for 24 hours, and then comes back, that child needs to be examined by a physician and probably treated with antibiotics. Diagnosing pneumonia, we listen to the chest with a stethoscope. There's a very specific sound that we hear that's the sound of fluid inside the tiny little air sacs of the lungs. We call those ralls or crackles, and those are strongly suggestive of pneumonia. We may or may not get a chest x-ray. Sometimes the history in the exam is all you really need to know. Sometimes we do want to get a chest x-ray. Sometimes we see a pneumonia on chest x-ray that we didn't hear when we listened to the lungs. Sometimes we hear a pneumonia that doesn't show up on chest x-ray. Either way, it's probably appropriate to treat that pneumonia with adequate antibiotics. Now, if the pneumonia doesn't seem to be responding, the child seems to be worsening, having ongoing fever, having trouble breathing or chest pain, please have the child re-evaluated. Pneumonias can get worse, and while we think of this era, the antibiotic era, as a time when children don't die of pneumonia, they most certainly can, and they can get very sick. So if you're at all worried that your child isn't responding appropriately, please call your child's doctor and have him or her seen again. Talking about treating pneumonia in children, I'm Dr. David Hill.